I only have one message to give you. I don't care what you think of me. I don't care what you call me. I do care what you do with this information because it is important to our survival as a species.
Got a couple things real quick before I get into what I want to cover. This website, gunloot.com, it's run by this dude I met on Twitter. Seems like a pretty cool guy. He is actually being censored right now. He's not allowed to advertise or sell his stuff on Facebook or Etsy. So Etsy, meanwhile, lets Antifa, stuff fly all day. You know what I mean? But they won't let anything in support of Kyle Rittenhouse, be sold. Things like Eat the Rich and, whatever. You can get Antifa stuff readily, but you cannot get a t-shirt to support a kid who is defending himself. So just so you know, go to gunloot.com if you want. I'm not being paid to say this. I just genuinely want to support the guy because I ordered this exact t-shirt and hopefully it should be in soon. And for $20, that wasn't a bad deal. So I was like, yep. But yeah, he's being censored. He's not allowed to advertise. Had his stuff pulled off Etsy. Meanwhile, you can still get all this crap off Etsy, and they don't care about that. But yeah, I just want to get into that. Also, Titus Frost, just saw this tweet this morning. I'm now officially suspended from YouTube on both channels for the time being. No more YouTube. Watch me on DLive. So yeah, go ahead, check him out on DLive. Been getting censored for a while now. His live streams for the longest time now have just been being pulled midstream without any type of explanation, or they'll say he violated some BS policy, which he didn't, and then they'll let him upload it the next day, but those strikes add up. So I've had a few on my channel, and then they'll block or delete a video, and then they'll release the copyright saying that I never violated it in the first place. But it doesn't take away the fact that the video got blocked and deleted and didn't get viewed, etc., etc. So censorship is happening. Richie from Boston, High Impact Flicks, Max Egan, you name it. So definitely support Titus. And if you can support, I'm not going to say his real name, but support him from gunloot.com. Seems like a really nice guy. You can get some cool stuff, not just t-shirts, but that's the only thing I've ordered so far. So, but what I wanted to get into today, actually, I've been researching the last couple days on these Arkansas camps, isolation centers they've been calling them. And I actually called the Department of Health in Arkansas and spoke with the public affairs woman, and she answered my questions. I also spoke with the Adjutant General's office and spoke to a lieutenant colonel who also answered some of my questions. But as far as I was able to determine, it's 100% voluntary and people aren't being brought there against their will. Now, does that mean that's the case? I don't know. I can't prove that. But they told me under no circumstance would it not be voluntary. And so today I actually saw this tweet. I think it was Defender of Liberty or something. But he posted how the governor of Ohio passed, I think it was August 31st in the middle of the night, a director's order. And this is called the Non-Congregate Shelter Order. I actually called the Ohio Department of Health. I'll probably include the phone call in this video if the audio quality is all right. But I did call them earlier, and he assured me that under no circumstance would it be involuntary. I'm going to get into that, though, because I believe that gentleman lied to me. So this is I, Lance Holmes, Interim Director of the Ohio Department of Health, pursuant to the authority granted to me in RC 3701-04 to require reports and make inspections and investigations that the Director considers necessary, to make special orders for preventing the spread of contagious or infectious diseases, to investigate or make inquiry as to the cause of disease or illness, including contagious, infectious, epidemic, pandemic, or endemic conditions, and take prompt action to control and suppress it. Order the following to prevent the spread of COVID-19 within the state of Ohio. Non-congregate sheltering be utilized throughout the state for those who are unable to safely quarantine in their place of residence and to isolate those diagnosed with or showing symptoms of COVID-19. Examples of the types of persons included in this order are those who test positive for COVID-19 who do not require hospitalization but need isolation, including those exiting from the hospitals. those who have been exposed to COVID-19 who do not require hospitalization, and asymptomatic, that means not showing any symptoms, high-risk individuals needing a social distancing as a precautionary measure. Sheltering specific populations in non-congregate shelters should be determined by a local public health official's direction or guidance and should be based on individual needs. Now, March 20th, when they declared, I believe that was the last day or one of the last days, we had one of the last federal emergencies declared or states of emergencies. I think there's 31 ongoing right now if I look. No, in March, we have, as of March, 60 national emergencies had been declared. Okay, let me see if I can, all right. So basically, and it also goes on to say that they could use colleges and other facilities as medical facilities if they needed to. And this is the number that I called, 614-466-3543. That's who I called. If you have any questions, call this number. And you can read the whole thing if you'd like, but it was signed August 31st by Lance Himes, Interim Director of Health. Now, I was told by the gentleman on the phone that under no circumstance would it be involuntary that you would have to go there. Okay. Let's just put that to the test. Right here is a Ohio Department of Health limitations on movement and infection control practices version 3.0 from July 2001 off Ohio's own government website. This is a document you can get yourself. Now I'm going to go to page 20, I believe. Let me see. All right. So section 5 on page 20 says enforcement of community containment measures. Alternative arrangements may need to be available for those who cannot or will not comply with voluntary home-based quarantine. Each health district will need to consider official, legally binding quarantine orders. Will electric forms of monitoring be necessary? Are detention facilities necessary? Why are they asking that question? Detention facilities. Will a quarantine guard need to be posted? Why would they need to do that? If this is 100% voluntary and under no circumstance would it be involuntary, why does it say right here on the Ohio's own government website that alternative arrangements may need to be available for those who cannot or will not comply with voluntary home-based quarantine? So did he lie to me? You be the judge. Because he told me under no circumstance would it be involuntary. Right here it says they can force you to comply if you don't do it. And that's, like I said, Ohio Department of Health limitations on movement and infection control practices version 3.0. All right, so let's check this out. Coronavirus in Ohio. Requiring written consent for contact tracing will slow down tracking, health officials fear. So getting permission to find out where you've been, who you've talked to, etc., getting permission from you to get that information is going to get in their way. You know what I mean? And this didn't pass, by the way. This article was written in June, and the amendment or the addition to get that written consent did not pass, by the way. So they can do it without written consent. Let's see. Contact tracing is a frequently used tool by health departments during all kinds of infectious disease outbreaks, and nobody's trying to stop it, at least not me. The GOP-controlled Ohio House of Representatives passed the changes last week along party lines, but the Ohio Senate rejected those changes Wednesday, expressing concern about the written requirement. Just like firing a gun in your backyard or yelling fire in a movie theater, you do not have the right to infect your friends and neighbors with a disease simply because you want to exercise the ability to not sign a form for contact tracing. So what they just told you is you must comply, you have no choice, you're a slave, you're not free, and you can't make your own decisions. And they always use that yelling fire in a movie theater as an example. That in no way correlates to you not wanting to give away your personal information to a stranger. There's no correlation. If you don't want to give your information to someone, you don't need to. That is not a right to put my family at risk. Yeah, well, Dave Burke, you're a nobody, and no one cares what you have to say, and hopefully no one complies. Hamilton County Public Health spokesman Mike Samet said obtaining written consent would slow down their ability to reach potentially infected people and slow down the virus's spread. This bill would absolutely negatively impact our ability and success with contact tracing, he told the Inquirer. What's next? The bill will be sent to a conference committee of House and Senate lawmakers to hash out differences. I haven't seen anything come of this yet, but as far as I know, it didn't pass, and they don't need written required consent to get your information. So like I said, with this non-congregate sheltering order issued by the governor and lieutenant governor and interim director of the Department of Health, they can take you and bring you to a facility to isolate if you don't meet the requirements at your house. And if you, according to the Ohio Department of Health limitations on movement and infection control practices off the Ohio government's own website on page 20, section 5, it says that they can force you to do it if you will not comply with voluntary home-based quarantine. But the gentleman on the phone for the Department of Health told me that under no circumstance would it ever be involuntary. So someone's lying. Someone's lying. Is it voluntary or is it not? Am I free or am I not? That's my question. I don't live in Ohio, but that's what you should be asking if you do live in Ohio, right? Because these people are trying to set up camps. Guys, no matter what their order is or what their reasoning is, the fact of the matter is this disease, per the CDC's own admission, hasn't even killed 10,000 people in the United States. That is not a pandemic. You can argue with me about what a pandemic technically is. This does not constitute a pandemic. I don't care what you say. It's all about control, and I'm not going to argue with you in my YouTube comments about it. How about that? My point is, if you don't see that this is all about control, you don't see the fact that they're setting up tents, or not tents, sorry, they're setting up isolation centers, and they'll force you to go there against your will. That's what you need to understand. They're not going to call it a FEMA camp. They're not going to call it martial law. They're going to call it an isolation center. They're going to call it a curfew. They're going to call it a lockdown. They're going to call it flattening the curve. Check this out, guys. Remember, even if you're asymptomatic, if you've been determined to have been exposed to COVID-19, you will be required, if you can't socially distance per CDC guidelines, have to shelter in a habitable facility. And the guy even said on the phone, he said they follow CDC guidelines. CDC guidelines for a suitable habitable shelter means that you have to have your own bathroom and you're not going to be spreading disease to other people. Now check this out. This is an article from time.com. I've already gone over this article, but let me go over it again. For months, researchers have warned that people without any COVID-19 symptoms could still be silent carriers of the disease, making it that much harder to get the pandemic under control. It's not a pandemic, it's us they're getting under control. And that much more important to take precautions like social distancing and wearing a mask, even if you feel fine. So it came as a surprise when Maria Van Kerkhove, the World Health Organization's technical lead for COVID-19, said at a press briefing on June 8th that asymptomatic transmission appears to be very rare. Her statement came just days after the organization directed healthy people living in areas with widespread community transmission to wear fabric face masks in public to help contain the advance of the disease. In an interview with Time following the press briefing, Van Kerkhove said she did not mean to suggest that asymptomatic people cannot spread COVID-19. Okay, now listen to what she says. I did not say that asymptomatic cases cannot transmit. They can. Okay, so she just made a positive claim saying that indeed asymptomatic cases can transmit. She just said that, all right? Then she immediately says after, the question is, do they? And if they do, how often is it happening? Okay, so you just claimed that they can spread. And then the very next sentence you said, well, do they? And if they do, how is it happening and how often? So is it or is it not? Because this clarification, if anything, only made what you said before that much more confusing. So if you're not showing any symptoms, but a contact tracer decides that you have been exposed to COVID, you will, as far as this document is concerned, by the Ohio government, have to quarantine. And if you won't comply with voluntary quarantine, alternative arrangements may need to be available, e.g., isolation centers and isolation facilities. So he told me it would be voluntary, but right here, this document off Ohio's own website for the Department of Health, the same gentleman, or the department this gentleman works for, told me the exact opposite. So which is it? Which is it? Is it voluntary or is it involuntary? Check this out, guys. Bet you never knew about this. This right here, let me see if I can pull it up. This is the 2019 National Threat and Hazard Identification and Risk Assessment. This was produced July 25th, 2019. This is an official FEMA document off the FEMA.gov website, guys. Check this out. When I type pandemic, and I scroll all the way to the end, remember, this was released in July, well before the first reported case, even before Event 201, where they predicted it would happen because they planned it out, obviously. This even preceded that. Listen to what they had to say. This is a pandemic scenario. This was written before the first reported case, months before. In early October, the Centers for Disease Control and Prevention, the very same people who just came out and said less than 10,000 people have died from this, keep in mind, reports a new novel strain of influenza virus in the National Capital Region. What are we dealing with now? A new novel coronavirus. That's so weird that you predicted this. So weird that Event 201 predicted this. It's just so many coincidences, right? But I'm not a coincidence theorist. Less than 2 weeks after the first confirmed case is identified at a local hospital, the illness causes hundreds of fatalities and thousands of people seeking medical attention. As the virus spreads, approximately 30% of the population across the United States and other countries becomes severely ill. Conventional flu vaccines are ineffective against the current strain, and the CDC estimates that a new vaccine would be months away from mass production. What do we keep hearing? We cannot return to normal unless we get a vaccine. Everything hinders on a vaccine, right? Because of the pandemic, social distancing is in widespread effect. Wow. Right, months before, guys, remember, this was written months before. Utilities, police, fire, government, and other essential services are disrupted due to social distancing and emergency absenteeism. Businesses close. What are we seeing? Resulting in a large-scale loss of services across the region. Examples include banking, food stores, and gas stations. There is a shortage of medical supplies, equipment, bed, healthcare workers, and hospitals are quickly overwhelmed, with up to millions of individuals seeking outpatient medical care and millions more requiring hospitalization. Civil disorder contributes to the high rate of absenteeism and the overcrowding of hospitals and medical centers. Now, we are having civil disorder, but that's because they're using groups like Antifa as proxy armies to achieve their goals. This is asymmetric warfare. There is no pandemic, there is no virus, I don't care what anyone says, and if there is a virus, it was created in a lab and intentionally distributed. Those are the only two options. Either it's not real or it was created as a weapon. But if less than 10,000 people supposedly died from it so far in the US who didn't have comorbidities, and they can only attribute that directly to the virus, which admittedly they also haven't identified or isolated in a lab, and also admittedly the tests for are wrong up to half the time, why would we believe anything these people say? What we can verify is that they made these predictions before, and then coincidentally it happens, and now they're setting up camps, and they will take you against your will, as according to the Department of Health's Limitations on Movement and Infection Control Practices' own words in their own documents, page 20, section 5, that you will be brought into an alternative arrangement, i.e. isolation facility, if you refuse to cooperate with voluntary quarantine. These are the facts. These are the facts. If you're asymptomatic and you've been determined to have been in contact, it doesn't matter if you have no symptoms. If you refuse to quarantine, they will bring you to a camp and they will force you to do it. Seriously. You don't believe me? Call this number, 614-466-3543. Department of Health in Ohio. They're open until 5 o'clock today. Give them a call. Let them know how you feel. Ask them about these documents. Ask them, say, hey, what about the Ohio Department of Health Limitations on Movement and Infection Control Practices version 3.0 released in July of 2011, page 20, section 5? What about that? Ask them about that. Ask them about the U.S. Army Internment and Resettlements Operations Manual. Ask them about the fact that they don't need your written consent and they didn't want your written consent to contact Tracy because it makes it harder for them to do it. What about the fact that FEMA predicted this months before it happened, July of last year? And who's in control of our country right now? FEMA. So basically, what my question was about the isolation facilities. If anyone would be required to quarantine against their will, like say if they, their house didn't meet requirements, CDC guidelines as a suitable habitable dwelling to quarantine or isolate in, then having to be removed and go maybe to an isolation facility. He said that it would all be voluntary, and that under no condition would it ever be involuntary. But I'm actually reading right now the Ohio Department of Health limitations on movement and infection control practices. Are you familiar with that document by any chance?
No. Where did you find it?
It's off the odh.ohio.gov website. And I'm looking specifically.
Sounds like something that would be under the Bureau of Infectious Disease. Is that?
Well, it says Ohio Department of Health. That's why I was curious. Because on page 20 right here, there's a section. It's called Enforcement of Community Containment Measures, section 5, and it says, alternative arrangements may need to be available for those who cannot or will not comply with voluntary home-based quarantine. It then also says, each health district will need to consider official legally binding quarantine orders. Will electronic forms of monitoring be necessary? But then it asks, curiously, are detention facilities necessary? But then also, will a quarantine guard need to be posted? So in this instance, on this document from the Department of Health in Ohio's website, it's showing me that they can, in fact, under Section 5, page 20 of that document, quarantine you against your will. So I was just trying to find out if this document is authentic, and if so, who could I ask questions more about in regards to that? Just because it seems to contradict what the gentleman told me. So I was just curious if I could get more information on that.
Does it say anywhere on the document if it's from the Office of Emergency Preparedness or Bureau of Infectious Disease?
It says.
I mean, those are components of ODH.
What is the little like insignia? Do you guys have like a little code that you put? Like you'll say like it might be like 6 digits you'll put on your documents so you know it's like for internal. Like would ODH IDCM be familiar to you? That's what I'm seeing on all the documents on the bottom left.
Okay, that's the infectious disease manual.
Okay. All right.
So that would most likely be by the Bureau of Infectious Disease. It doesn't sound like it's specific to COVID-19, though.
No, I was just curious because they're setting up specifically isolation centers for COVID-19, not other infectious diseases. That's the only reason I'm asking about it, because it doesn't seem to be in regards to anything aside from COVID-19. So that was my question, was would anybody be quarantined against their will due to COVID-19, being asymptomatic, and maybe being contacted by a contact tracer because maybe they were associated or had close exposure. The gentleman did define the terms, or how you guys define exposure and how you go by the CDC guidelines for that, like being in a car versus being outside, properly social distance and all that. So I do understand the differences in the exposure. I was just curious how to get more information on this document. Would I have to talk to you guys? Is there a number I could call for the Infectious Diseases Bureau? Is that something that I would be able to do?
I could actually transfer you over to the Bureau of Infectious Disease, but I'll give you their number just for future reference. It is 614
Yep.
466 3543.
Anytime today, but so you had.
Yeah, the question that I have, I was told by the supervisor when I called before that under no circumstance would someone be required to quarantine against their will or be brought to a facility against their will for COVID-19. And I know that they do have the isolation facility set up, but to my understanding, it's voluntary. So, but I've come across a document since speaking with him. It's from the Ohio Department of Health's website. It's called Limitations on Movement and Infection Control Practices, Volume 3.0, released July 2011. Are you familiar with that at all, that document?
I am not familiar with that document. Let me get over to the ODH website real quick, and can you just point me to where you found that?
Yep, it's a long document, but I can give you the, it's odh.ohio.gov under a section called WPS, like /WPS/WCM. And it's just, you might be able to type in limitations on movement, and that might bring it up if there's like a search part of it. But while you try to find that, I'm going to see if I can bring up the section.
I see it here.
Do you see it?
Limitations on movement and infection control practice. Yep.
It's 92 pages. That should be the one.
Yep, I see it.
All right. So my question was on page 20, section 5, where it says enforcement of community containment measures. Section A, it specifically states alternative arrangements may need to be available for those who cannot or will not comply with voluntary home-based quarantine. It then also goes on to mention that detention facilities, would they be necessary? Would a quarantine guard need to be posted? Things like that. So that seems to be in direct contradiction to what he told me. So I was curious if this document would be applied to the isolation centers were someone not to comply with a quarantine. Would they then, in certain instances, be brought against their will to quarantine?
Right. So, in general, I don't think that this document would fully apply to the COVID-19 quarantines that we're talking about. And I believe, I know the person you were speaking with now just by your description, probably. And he is correct. At this point, the ODH has no plans to ever hold anybody against their will or take them to any kind of detention facility for a quarantine. This document is more of just a kind of checklist for ODH and local health departments to work through in the event of infectious disease protocols like this. So you can think of situations like the Ebola outbreak that we had several years ago, where Ebola is extremely infectious, and if somebody is not willing to quarantine, there may be the need to detain somebody.
Well, that's what I was curious about.
Extreme of circumstances.
That's what I was curious about, because to use the Ebola pandemic specifically, or possible one that could have been, did you guys at that time set up isolation centers specifically for Ebola when that was happening, or is that something that you didn't do?
That is not something that we did. As far as I'm aware, we did make sure that areas of a hospital were quarantined and that a person could stay there, and that they were limited of movement because of the extreme nature of a virus like Ebola.
But now, according to
COVID-19, it's not the same.
Well, I was just going to say the only isolation facilities that have been developed for any specific infectious disease in the state of Ohio thus far have only been for COVID-19. Is that correct, if I were to state that?
I'm not aware of that.
Okay, guys, COVID-19 is the first instance in which the state of Ohio has used an isolation center for an infectious disease. Prior to that, it has not been done. This is an article from Bricker.com. It's entitled COVID-19 Update. Ohio issues final plan for healthcare isolation centers. And it says, healthcare isolation centers play an important role in Ohio's response to the COVID-19 pandemic by relieving pressure on hospitals for post-acute care, conserving existing care resources through avoiding or delaying hospitalization, and supporting long-term care facilities that are unable to maintain sufficient isolation and or clinical support for residents. This article was May 26, And this is the finalized version of it that you can download yourself. Let me zoom in. And it was finalized April 16th, 2020. Prior to that, they didn't have an isolation facility center plan, just for COVID. Why the overzealous response to a disease that hasn't even killed 10,000 people? Just the disease. Do we need to set up isolation centers? You heard it. They didn't do it for Ebola, which makes you bleed from every hole in your body and die a horrible, agonizing death and is supposedly one of the most infectious diseases known to man. But we did it for an influenza strain. An influenza strain, mind you, that Fema and World Economic Forum, Bill and Melinda Gates Foundation, and Johns Hopkins University of Medicine, among other groups like the Rockefeller Foundation, look at the lockstep paper from 2010, simulated influenza pandemic coronavirus strains months before it happened. This in July, right? See if I can find it. July 25th of last year, and this, October of last year. Right before the first reported cases. Funny, huh?